I think money becomes a very significant factor when choosing a branch because radio, as you know, पैसों की बरसात.
No, it's not like that. There's so much of investment in that. Similarly in Patho, that is why I didn't mention that point कि पैसे आ रहे हैं इसके लिए we people are running towards radio and Patho. So it's like that. Then other thing is the hematology part. Hematology is तो like वो पता ही है ना खून की जांच करते हैं डॉक्टर सारे. तो you get a CBC done.
Interns निकालते खून और pathologist
जांच करते हैं. I remember when I was pregnant at that time. Initially तो I was being judged only कि how did she even decide this thing to have a baby in residency? I mean, ऐसे क्या होता है यार?
Speaking more about work life, I want to know how has your PG life impacted your घर की life. Hello everyone, welcome back to my channel. Welcome back to the Pluripotent podcast. Today I'm going to be having my sister Dr. Anuj Pachhel over here with me, and we're going to have a casual candid chit-chat. She is an MD pathologist and she's got a lot of things to share, especially with respect to PG residency work-life balance and how she manages being a mother as well as a student. So it's going to be interesting, and I welcome you to my podcast. It's been, I think, almost 2 years since we last sat down and recorded a video together.
Since the last time, I think it was 2 years back, we had a chit-chat and I was eagerly waiting for this opportunity to talk with you.
I'm just gonna say, हम लोग रोज बात करते हैं, but podcast हम बहुत दिन बात कर रहे हैं.
So I'm MD Pathology. I did my PG from Rajiv Gandhi Medical College in Thane, and very soon I'll be starting my SR-ship, that is senior residency, which is a bond basically which you have to complete after your MD. It is mandatory for all the residents. It is a 1-year tenure. So soon I will be doing that.
Okay, so directly, first of all, I want to
Yes.
say a lot of the questions that our viewers asked us was like, today the trend is radiology. Okay, like 15-20 years ago the trend was surgery, and before that it was maybe orthopedics or medicine or something. So every few cycles the trend in our field changes. Since we are going more towards, I think, in a field where work-life balance is prioritized rather than working so much. Okay, like nobody wants to get up at 2 if they have to go and operate a perforated duodenum, right? They want to sleep at 2. So there is nothing wrong with either of them. Okay, you can have interest of one and not the other. So the thing is, like, do you think that pathology will have such a rise in the future, or maybe it is having right now, like radiology is having? Because I see a lot of people that are in internship with me that are fixated upon diagnostic branches rather than core clinical branches.
Okay, so the very first thing that's the difference between a clinical branch and a diagnostic branch. A clinical branch is definitely an emergency branch. In emergency branch, it is tough to manage your work-life balance as compared with the diagnostic branch. I won't say that we cannot at all, but obviously it is subjective. But in a branch like pathology, it becomes a little bit easier as compared to what other branches, heavy branches are. So nowadays, people are very much aware and they have other things also to do apart from their academics. They are interested to pursue their hobbies. They also want to live their life apart from the profession. So for people like that who are not entirely into academics, diagnostic branches are good, but it does not mean that academically these are lesser branches. They are extremely heavy branches because recently I've been giving my this MD examination, and I realized that I had to literally read everything about every branch. Patho is such a vast branch to study, but yeah, if you just correlate it with the working pattern of other branches, it is a bit easier, not too, but a little bit easier.
Got it.
Yeah.
Definitely, because you don't have to go at 2 to repair a perforated duodenum.
No, we don't have to go at 2, but of course there are emergency days in Patho. It does not mean that we don't have call days, but they are not like working for 2 to 4 hours operating or something like that, or running into the casualty and shifting the patients from the trauma center into the OT. It's not like that. But obviously, if parallelly, when the emergencies are going on in the ward and in OTs, pathologists are the people who are behind the door and they are not seeing what they are doing actually at the night. So there are so many things that a patho resident has to do at night. Like there are so many fluids, emergency fluids that you have to report down because according to the report of that fluid, it depends how the patient is being treated. There are colleges where even autopsies are performed at night, medical autopsies are performed at night. There are so many things. So it does not mean that we are not going to do anything at night, but it becomes easier. Like it is very tough for the first year residents. With eventually with as you become a JR2 or as you become a JR3, that emergency level little bit comes down.
Right, of course. So it was like, my main question still remains, do you think that there's going to be a rise, like radiology saw the rise, right? And like few years ago surgery saw. Today nobody really wants to go for surgery.
Yeah.
The top 200 branches in last NEET PG, I think 4 or 5 people took surgery, and 50%, that is almost 100 people took radiology.
Yeah.
So you can see the paradigm shift. Like this was not the case 15 years ago.
Nowadays all the toppers, either they want to be a radiology, they are either towards radiology or they are towards the mat. This trend is a totally, and I don't understand why people are like dermat versus OBGY. I don't understand the relationship. Why is it dermat and OBGY? Those two are completely contrast branches. I mean, you need to decide your priorities. OBGY is something totally different. You have to dedicate yourself 100% to being a gynecologist. I would say dermat, it is well and good. Work-life balance like patho and a radio. Shift, I would say, is because, first of all, the very reason is that you are able to manage your work-life balance. And second, in a diagnostic branch, there are many opportunities in future and you are not stuck. Like you can go for teaching profession, you can open your own private labs, you can attach to some corporate sector, you can perceive some super specialty. Patho and radio are usually terminal branches, but nowadays there are so many things apart from MD that you can do after MD. Like radio has a very good thing called as interventional radiology. So interventional radiology, radiologists are very few. So basically it is a branch where through intervention you are actually treating a person. So it has now become a very, a trending thing among youngsters ki, I'll go for radiology, I'll go for interventional radiology. Similarly in pathology there is a branch called as oncohematology. So you are dealing with all the cancer patients like that. So there are many opportunities like that post MD. So I think the trend is like that ki, I would say that only, that it is a cool branch. That is why it is growing first of all.
Okay.
Yeah.
But I personally feel like instead of just looking at the work-life balance, I think money becomes a very significant factor when choosing a branch, because radio, as you know, पैसों की बरसात.
No, it's not like that. There's so much of investment in that. Similarly in patho, that is why I didn't mention that point कि पैसे आ रहे इसके लिए people are running towards radio and patho. Because see, in a branch where it is completely clinical branch, for example medicine, you just open your OPD and you start earning. There's no investment. It's just your knowledge which is going to give you money. But a branch like patho or radio, you have to have a core investment first, and then only you can go for private setup. Na?
Yeah, I get your point, but I still feel like radio and the branches which don't require, which are not limited by you. For example, if you're a radiologist, you can just sit down and see so many reports in one day. But you cannot perform so many operations in one day, or you cannot see so many patients on a day. Okay, so you definitely are going to make more money if you are going to be going towards a branch which does not require that much time per.
See, I would rather say that post-traumatic stress is a little less. Okay, in a branch like surgery, it's not just operating and leaving. You have to manage the patient till the entire post-op period. That is maybe 5 days or 10 days, depends on the surgery. But for patho, it's not like that. Once you sign the report, you're done with it and you're over with it. And nowadays, very good thing has come up, that is digital pathology. I'll be telling in detail about this. So digital pathology is something like you are sitting somewhere else and you are reporting a thing which is happening completely elsewhere. So this has given females a very good opportunity, to sit at home and just do the reporting on the basis of so much improvement with the technology that we have now. So digital pathology cannot be applied anywhere in any other branch. Maybe I think it has come up in radio where like in my college itself, there used to be MRIs and CT scan actually happening in my college, but the reporting used to happen in Pune, and then they used to send the reports over here and send it to the patients. because a full-fledged MRI and CT was not developed in my college at that time. So that is something called as digital radiology. Similarly, it is happening with digital pathology. Robotics are coming up. There are so many things. There's AI in pathology, that is artificial intelligence in pathology, where actually virtually you are going to see the entire slide sitting somewhere else, and the slide is actually somewhere else, and you're sitting and seeing it somewhere else, like that. So that is the benefit of Patho, that you can just be anywhere and report anything around the world. That is the beauty of
that's
the
the flexibility
technology.
of it, right? And it's gonna get better as it goes on.
And in future, that is the trend. You know, in after 10 years, you see this is going to happen, and this is going to be very common. This is going to be everywhere, applied everywhere, because with this you get to get the opinion of person sitting somewhere totally different, having a super speciality somewhere else. He's sitting maybe in Mumbai, and I'm sitting in Nagpur, and I want to report done with that specialization. I can do it.
That's great. So you were telling about the different jobs that a resident has to do. So I want to ask, what according to you is like, what did you do as JR 1, 2 and 3? And what are the different sub-branches under which you are placed in pathology? If somebody was going to be a resident patho, the brief initiation or introduction, okay, this is what your life is going to be for the next 3 years.
Okay, so I'm getting so many messages everywhere in Instagram and all, especially those who have given need ki, how is Patho as a branch, should I take it? Oh, it is a paraclinical branch, it was not my preference, but just because of the marks I have to compromise with this branch. There are so many people like that. So see, Patho, it is tough academically. You have to study a lot in that. For all those people who are thinking कि नहीं Patho लेके मैं तो chill हो जाऊंगी, it is not like that at all. You have to study right from day one. It is tough because you are going to be the whole and sole person deciding the diagnosis of the patient. Okay, everything depends on what your report goes. So it is like that. You cannot just be very casual about reporting. You have to be confident, and for being confident, you have to be very academically strong. That is the thing. But as a resident, I would say that see, residency part in JR1 ship, there are so many different sub parts of Patho where you will be posted. Patho,
in rotations.
In rotations. Patho is not just about seeing the slides and reporting them. Okay, autopsy comes under Patho. I think very few people know this thing. Non-medicos, I think they don't even understand that autopsy is a part of Patho, not just about forensic medicine. उनको ऐसे लगता है कि अरे ये पोस्टमार्टम करने वाले लोग तो forensic medicine के होते हैं. ऐसा नहीं है. forensic medicine में वो लोग पोस्टमार्टम करते ज़रूर है, but end में reporting उसकी Patho वाले ही करते हैं. ठीक है? So there is a thing called as autopsy, a medical autopsy, in which we get the whole bunch of organs, and we have to do grossing. So grossing is like you're getting the organ and you have to examine the organ completely externally. You have to make slices of it, and then the slides are being processed, and those slides are being reported. So all these things, the entire step is called as histotechnique. Okay. So histotechnique is basically, it is a part of histopathology. And right from how you are handling the specimen, how you are cutting the specimen, to how the slide is being processed, it is being stained, and to the reporting, the entire procedure is a very lengthy procedure. So that is about histopathology.
So that is one thing.
That is one thing. That is one sub part of Patho. Okay. And the another one is cytology. Cytology में basically the first thing is कि FNAC जो सबसे commonly लोगों को पता है. ठीक है. FNAC is fine needle aspiration cytology. So इसमें क्या होता है ना कि if there is a swelling, so you just if a surgeon sees a swelling, so he will immediately send it to us. He will send the patient to us, and what we have to do is we have to take a needle, puncture the site, and extract material from it. And according to the cellular structure of that material, we are going to examine the entire slide and give the diagnosis. Most commonly, which I encounter, is a cervical swelling, that is tuberculosis, or maybe sometimes we see malignancies like breast cancers, which are very easily screened on FNACs instead of going for biopsy. I think FNAC is a very good option for
breast cancer screening.
if it is clinically you're quite confident that yes, this will be a CA case, this will be a carcinoma case. So it is easy instead of going for, because biopsy takes a very long time for reporting as compared to FNAC. FNAC will give you a report within 2 or 3 days, but in case of histopath, it is going to take at least 10 days in my institute in a government college where the workload is so much. At least it will take 10 days. In private, maybe you will get it within 4 to 5 days. So it's like that. Then other thing is the hematology part. Hematology is तो like वो पता ही है ना, खून की जांच करते हैं डॉक्टर्स सारे, तो यू गेट अ CBC डन,
इंटर्न्स निकालते खून और पैथोलॉजिस्ट
जांच करते हैं. तो दैट इज अबाउट हेमाटोलॉजी. सो वी एनकाउंटर सो मेनी ब्लड कैंसर्स ऑन डे टू डे बेसिस. देयर आर सो मेनी सबक्लिनिकल केसेस दैट आर देयर आर नॉर्मल काउंट्स, बट ऑन द बेसिस ऑफ अ पेरिफेरल स्मीयर वी आर एबल टू मेक आउट दैट इट इज अ केस ऑफ अ मैलिग्नेंसी, इट इज अ केस ऑफ अ ल्यूकेमिया. So that is, I think, a very good thing, and it is a beauty of pathology that machines can do the reporting, but nothing can substitute a pathologist. ठीक है. सो ये जो तुमको सब क्लिनिकली एक ल्यूकेमिया डायग्नोस करना है, ये सिर्फ अ पैथोलॉजिस्ट कैन डू. नो मशीन्स कैन डू इट लाइक दैट. Yeah.
Great. So three
apart
things.
from this, सबसे important thing, there's also a blood banking sector because pathology also involves transfusion medicine. Okay, so transfusion medicine is a blood bank in which we are supposed to screen for the donors and take blood from them, and then we are supposed to give blood to the patients like that. So the entire process of blood banking is
right,
also
from
very big.
Collection to processing to storage to dispensing.
Yes, to dispensing everything. There are various camps, blood banks that Patho people organize.
Okay. So it's like a very interesting branch in which you get to see almost every specialty, right? From basics to ENT to obs gynae to surgery to medicine, सब कुछ मिल जाता है.
Patho people will be aware of each and everything going on in the hospital because they are in touch with medicine people, they are in touch with surgery, they are in touch with obstetrics and gynecology. They know each and everything. It's like that.
And the anesthesia people know everything that goes on in the OT.
Yeah, definitely.
So you and Jija ji together know everything that is going on in the hospital.
One of my professor used to say the toughest branch in medical faculty is anesthesia and pathology, and I was like, we both chose that because these people have to know each and everything.
Nice. So I want to know ki in first year of residency, what are the working hours like, and what are the duties that you get? So how many months are you placed in histotechnique, then histopathology, cyto, hemat, blood bank?
Okay, so see, the working hours depends on college to college. I wouldn't say it is fixed. It is patho ले लिया तो ये working hour है, ऐसा कुछ नहीं है. See, in institutes which are very big with a heavy burden, routine hours में ही उनको रात के 10 और 11 बज जाते हैं. ठीक है. तो my institute was a medium institute. It was not very less, not very heavy. It was like adequate patients, adequate knowledge.
Not overburdened.
Not overburdened. We used to get adequate exposure. As a resident part, I saw quite many things over there. The only drawback was that it did not have a super speciality. Okay. In my institute, there was no super speciality. So that was the only drawback. Otherwise, I think I have seen quite much and learned quite much from that institute. So working hours would be, I would say that a resident has to touch by 9 o'clock. मतलब touch हो ही जाना है 9 बजे. Then by evening, I think 6:30 we used to get free.
So JR1 में.
नहीं, everybody. It is for everybody. Okay. It is like it is not about कि JR1 हो तो तुमको 6:30 और 3 JR3 हो गए तो तुम 2 बजे ही फ्री हो जाओगे. Unlike clinical branches ऐसा नहीं होता है क्योंकि
नहीं, clinical branches में JR3 नहीं आते ना.
नहीं, हमारे में ऐसा नहीं है क्योंकि first thing I would say, भले अगर if you don't have work but your teachers are sitting there till 5 o'clock, so you have to sit there. ठीक है. तुम obviously तुम student हो and your teachers are sitting there, you just cannot leave ना. So all the residents, they have to stay there at least till 5:30 I would say. After the teacher leaves and the work is done, you can go. JR1 को यूजुअली ज़्यादा काम रहता है तो वो बेचारे बैठ के अपने एक्स्ट्रा के सारे काम धीरे धीरे रात तक के करते रहते हैं और फिर उसके बाद ऑन कॉल शुरू हो जाता है. ऑन कॉल इज समथिंग कॉल्ड एज एन इमरजेंसी ड्यूटी. सो इमरजेंसी ड्यूटी पर्सन इज रिस्पॉन्सिबल फॉर हैंडलिंग ऑल द ओवरनाइट सैंपल्स व्हाटएवर इज कमिंग.
So how many times in 1 week do you have to do emergency?
When I was a first year, we were 6 residents, so 2 दो लोग का एक दिन ऑन कॉल रहता था तो एवरी थर्ड डे आता था हमारा. बट फिर जब JR3 हो गए एक्चुअली ना मैं तो JR2 कभी थी नहीं, मैं JR1 से डायरेक्ट JR3 बन गई ना, क्योंकि आई वाज अ कोविड रेसिडेंट. तो कोविड में हमारा ऐसे हुआ कि देयर वर नो जूनियर्स ओनली, सो हमको 2 साल तक जूनियर्स नहीं आए थे, तो वी वर JR1, JR3, सो देयर वाज नो JR2 शिप. आई डोंट नो, सडनली फ्रॉम JR1 वी बिकेम एग्जाम गोइंग बैच. तो एग्जाम गोइंग बैच वाज JR3 एंड अब्रप्टली हमारे 2 बैच जूनियर्स आ गए. सो देयर वाज अ बिग ट्रांजिशन. तो बट बाय द टाइम आई थिंक वी वर JR3, तो हम लोग का वर्कलोड तो कम हो गया था, बट हम लोग को एकदम से पढ़ाई का बहुत और थीसिस का बहुत टेंशन आ जाता है. तो JR3 शिप इज ऑल अबाउट योर थीसिस.
Getting back to the main question, does this emergency duty happen only for particular subgroups, like only in hemat, only in cyto, or do you have to do it throughout the year of JR1 कि हर रोज तुमको night duty लगनी है? Just let's say I'm posted in histopath.
Yeah.
So do I have to stay back?
No, irrespective of where you're posted. After 5 o'clock, you are an on-call person responsible for the entire patho department.
Okay.
Okay, you're responsible for everything that comes, right from blood bank, right from hematology, right from cytology, everything. Histopath usually doesn't happen after the routine hours, because surgery सारी जो रहती है वो routine hours में हो जाती है. और अगर emergency surgeries जो conduct होती है जिसके specimens हमको आते हैं, that comes in the next day. Yeah. तो फिर mainly होता है हमारा सारे blood samples तुम्हारे आ गए उसमें, blood banking वाला part आ गया where you have to dispense the blood bags, and if at all कोई cyto का emergency fluid आ गया तो आ गया. बट CSF is something which has to be processed within half an hour. तो जैसे ही CSF आता है, all the residents be alert and they have to report it. It's like that. Because CSF में most common is meningitis, और meningitis के लिए you need early treatment. It's like that.
So I have 2 questions for the viewers who are watching this. She talked about FNSE. First one is, what is the gauge number of the FNSE needle that we are using? And second is, if you take an FNSE out of a thyroid gland and if it's suspicious of a cancer, which cancer can the FNSE not differentiate, and you'll definitely have to go for a biopsy? And those are the 2 questions. Write down in the comments and let me know what the answer is. So talking about your JR3, JR1, JR3. So you suddenly got a lot of things in your hand in JR3. You've got to study for your final exam, practicals. बहुत ज़्यादा हैवी होते हैं जो कि, एंड पैथो में आई हैव सीन दैट इट इज़ क्वाइट हैवी विद रिस्पेक्ट टू द टेक्स्ट. मतलब काफ़ी सारी बुक्स है. एंड मोस्ट इम्पॉर्टेंटली आई वांट टू आल्सो आस्क यू अबाउट थीसिस, बिकॉज विदाउट थीसिस you cannot become a PG student. Okay, thesis is a compulsory thing which you have to do. So I want to know about your experience with all of this.
Okay guys, so the very tedious part of residency is making a thesis. तो जिस दिन thesis complete होता है ना, उस दिन लगता है actually you have done your MD. So my thesis was about uterus, and it was a topic of tumors and tumor-like lesions of uterine corpus. So the sample size was quite large. It was 600. It was a COVID era, तो क्या हुआ ना, I had taken 600 का sample size, but later on the patients became less because of COVID, and my thesis involved elective surgeries. It was not an emergency surgery. So elective surgeries were all closed during COVID era. So my sample size reduced. So that became a benefit. थोड़ा सा वो easy हो गया, around 250 I did. But thesis is like, it is you are writing a book about that topic. It is equivalent to that. Okay? You have to know thoroughly about what that topic is, each and every detail of the lesion of that topic, and what are the recent advances in that topic. You have to be completely updated because it's your topic. First of all, कि तुम उस पे एक book लिख रहे हो, it is going to the university. Second of all, इस पे होता है एक वाइवा फाइनल ईयर में. फाइनल ईयर में rather I would say एग्जाम में थीसिस का एक अलग से वाइवा होता है, ठीक है, which is included in the grand viva. तो मेरा तो हुआ था उस पे अच्छे से. तो it is a grand viva. Thank you so much to my guide for helping me with my thesis, and obviously she helped me in my exams also so much, guided me everywhere. So you are allotted a guide right in the first year of your residency. Each student, PG student, is allotted a guide. So what is a guide actually? A guide is not just who will guide you in the thesis, but guide is supposed to guide you throughout your PG for
and
each
even after
small
that
thing. Yeah, so even after that, like there are people who find difficulties in job opportunities. So guides, they actually guide you. The naam hi hai wo guide. तो फिर my guide was a ma'am, a very senior ma'am, so she helped me out throughout my thesis, and उनके वजह से आई डिड अ वेरी ब्यूटीफुल थीसिस. एंड में पहले तो जब करते टाइम पे आई वाज सो एग्जॉस्टेड. You know, when I used to sleep at night, I used to just मुझे यही घूमते रहता था कि अरे ये सैम्पल में ऐसा था, वो सैम्पल में वैसा था. It was all so much in my head, and at the end I started clouding. मतलब हर चीज़ें cloud होने लग गई थी मुझको. But the thesis turned out to be very beautiful. I'll publish also hopefully. It was a very broad spectrum topic, so उस पे ज़्यादा studies नहीं हुए हैं, but that topic is very beautiful.
Great.
So thesis is something which will take months and months and months. And a very thing about PG is ना, जब तुम thesis करते रहते हो तब पढ़ाई नहीं होती. या तो पढ़ाई कर लो या तो thesis कर लो, दो में से एक चीज. So it is advised to all the PGs कि सबसे पहले ना अपना thesis complete कर लो. The fast you complete your thesis, the better it will be for studying. तो मेरे से वो थोड़ी गलती हो गई कि मैंने शुरू में बहुत lightly ले लिया, but बाद में फिर मुझे बहुत overburden हो गया था.
Okay. Overburden. तो how about the studies? काफी पढ़ना है, राइट?
पढ़ना तो बहुत पड़ता है. पढ़ना ऐसा है कि फर्स्ट ईयर में तो तुम काम ही करते रहते हो. इट्स ऑल अबाउट वर्किंग. एट द एंड यू आर सो टायर्ड दैट यू डोंट फील लाइक स्टडिंग. बट अ गुड पार्ट अबाउट पीजी इज कि रेगुलर बेसिस पे अगर पीजी एक्टिविटीज होते रहते हैं, लाइक एक्टिविटीज इन द फॉर्म ऑफ लेक्चर्स, इन द फॉर्म ऑफ सेमिनार्स, इन द फॉर्म ऑफ एनीथिंग, लाइक प्रैक्टिकल्स हमारे होते थे, जर्नल क्लब होते थे, ये सारी चीज़ें जो होती है, इन बिकॉज ऑफ दैट तुम थोड़ा एकेडमिक टच में रहते हो. And Patho mein the thing is that you have to have repetition of things. Like for slides you need to see so many slides, then only you will be able to remember them. There are so many lesions around, I would say 300 to 400 slides तो common है which you should know. एकदम टिप टॉप आनी चाहिए तुमको हर चीज़ें. तो उस चीज़ के लिए यू हैव टू गिव टाइम, डेडिकेट टाइम, सी ओल्ड स्लाइड, सी कॉन्फ्रेंस के स्लाइड्स, ऑल दीज थिंग्स. तो फर्स्ट ईयर में तुम यही सब करो. सेकेंड ईयर इज अकेडमिक जोन. सेकेंड ईयर में यू स्टार्ट स्टडिंग प्रॉपरली एग्जाम बेस के हिसाब से. यू स्टार्ट सीइंग प्रीवियस ईयर क्वेश्चन पेपर्स. बाय द टाइम थर्ड ईयर कम्स, थर्ड ईयर में यू आर इनटू की थीसीज अब सबमिट करना है, एग्जाम टाइम आ गया है. यू हैव टू सी वेदर योर पब्लिकेशन इज डन, योर पोस्टर इज प्रेजेंटेड, योर पेपर इज पब्लिश्ड. All these things, these are all parts of your PG, like paper, poster, publication, thesis, academic, all these things. And in Patho there's an additional thing called as tutorship. Okay. Which is like we are supposed to teach the UG students because it comes as a part of our curriculum. So we have to take practicals of second year UGs. तो वो भी एक हमारा part रहता है. इसमें we are also learning and we are making them also learn.
So you can go to her channel. She has recently started that. And you can go subscribe to her channel.
Yes, please everyone. I would be sharing so much about my PG, how to study, how to manage work life, and many more things.
Okay. Speaking more about work life, I want to know how has your PG life impacted your ghar ki life, personal life.
So for everyone who doesn't know, I am a mom to a 1-year-old. Okay.
1.5 almost.
I think she's 13 months. No, she's 15 months. Yeah, she's 15 months. So I am a mother to a 15 months old beautiful daughter. And I had her, I think, while I was in second year. Second year just मेरा complete हुआ था. That time I had her. Yeah. I took a 6 months का extension in my PG. So I was supposed to finish my PG in the summer of 2023. So I finished it in winters of 2023. I think that was fine. When I see at her, I feel that's completely okay for me to extend 6 months. I would rather extend 1 year for her. That is fine. Initially it was a bit tough for me to process this कि यार मैं अपने बैचमेट्स के साथ में अलग हो गई. My all the colleagues they were passing in front of me. मेरे सामने they used to go give their university exam. So it was a bit tough for me because I was the alone person left from my batch with my juniors. But then I think I got over it. And when I recently gave my exam and I finished everything, it suddenly did not matter at all. It did not. It stopped mattering to me because 6 months I think it's nothing. When you have a beautiful daughter, you look at her, I think that's all fine. So about managing, it was tough for me to manage because but one thing I did that I was working till my 8th month of pregnancy. So I was a second year resident. I was working till 8th month and that was fine for me because I had very cooperative teachers and cooperative juniors and batchmates, so I could manage the residency part in my pregnancy. But afterwards with the baby it became a bit tough because so many things keep coming. You just can because you are a resident, you are supposed to be in a fixed hour duty, and simultaneously this baby is small, she is having different issues, uska kuch beech mein aa jata hai, you have to manage that according. With that I had to do my thesis also in third year, my academics also, my regular duties also, and manage the baby, give time to her, and all these things. So it was very tough, but with the help of very good family support, of course mama, my this side, in-law side, and you for motivating me to study. So I think I could manage it, and when it is done, I see it was tough, but it was a beautiful journey.
Okay, so I personally feel like the trend of having babies in residency is not that popular in India, and the main reason is you are extremely overwhelmed by your duties to focus on anything. But if you look at the US, okay, if you look at the US, most of the people who are into med school itself are married. So if you just they do after 11th and 12th they do like 3 years of something called as I think pre-medical, and after this pre-medical they get into 6 years of med school. And if you see that ki after 11th and 12th 3 years, that's almost like third year in MBBS, and 3 to 4 years after that, that's like PG.
Basically after 12th it is 10 to 15 years passing your PG.
Yeah. So over there in USA, I feel like people get married, they also start having children before they are into the residency. And it is very common over there to see ki, okay, this is a resident, this is second year, third year resident, and they are going to have a baby soon, especially for females. Males में because थोड़े late होती है शादियाँ, उसके कारण late होता है obviously सब कुछ. But in here in India, I see like most people usually wait till after their MD or MS completion to get married.
You are being judged constantly here. You know, I don't know why this thing it is, but it is being glamorized. It is being completely glamorized to be overburdened, to ignore your personal life, and you know, expanding your families is something a taboo, and it is not supposed to be good. While you know, if you're too much into family life, it means you're ruining your professional life, you're not into academics. These things are being normalized here. I don't understand why. It's so wrong. I think your biology, basic biology, it should go on. There's a biological clock and it's ticking, and I think it is completely fine to have a very good family life, to go naturally, to have a baby. It's okay, and for that you need a very supportive partner.
I think it is more prevalent in urban areas, especially in the higher education. For example, in our medical generation, because if you go into our labor room, if you see the list of the patients, most patients will be younger than me.
Yeah, of course.
So every like 21-year-old G2, P2, L2. ठीक है, so that is the case है ना. And मतलब वही है scene कि I think medical field में it is like that comparing to other.
I remember when I was pregnant at that time. Initially, I was being judged only. Ki how did she even decide this thing to have a baby in residency? I mean, ऐसे क्या होता है यार? It's not like that. It's fine. And as far as it's concerned about managing, वो subjective है. हाँ, थोड़ा extra होता है, थोड़ा overburden होता है. But I think that turns out to be fine. उसमें इतना ज़्यादा उस चीज़ का taboo बनाने की कोई ज़रूरत नहीं है. It's like that.
And of course, you get the added benefit of getting a baby.
Of course, that's the best part.
So, how has motherhood shaped your life in the last 15 months?
Oh my God, so much. Such an emotional question. So, motherhood, it is unconditional love. It is something which you haven't felt at all, and you're feeling after seeing that child. You just forget all your stress. In the residency, there were moments when I had a breakdown. There were moments when I was so overwhelmed with everything. Especially while my thesis was going on, there was so much of I used to think, I'm not giving her time. I have so much going on here. In my MD examination wala period, the whole period, we have 4 papers and 2 days of practical. Us period mein bhi I couldn't give her
4
time.
4 papers, I think back to back.
No,
one day apart. And practical back to back.
Wow, that
Oh
was
my
too much.
God.
That was too much. So those that period I couldn't give her that much of time. But
Except for that 1 month.
Otherwise, when I used to be with her, it was completely her time. I did not think about anything else. And she's a stress buster. In a way that, while just playing with her you don't know this thing, now for playing 5 to 10 minutes with her, you just forget all your worries. It's
Exactly. So I'll tell you my experience personally with the baby. I wake up, I start studying, okay, and I feel like बहुत पढ़ लिया अभी नीचे जाते हैं ठीक है. She has been here since the last 1 week, so I'm telling the experience of last 1 week only, because for the last 1 year वो घर नहीं आ पाई थी because काम, thesis and everything, and she already had to quite a lot of extension. So anyways, I used to go down and just look at the baby and just play with her and just spend 10-15 minutes and clock reset. Okay, your stress is gone, you have forgotten all the negative things, and I think it gives you a new hope. And I think it's very positive to have like a small, little one going around here and there. एक छोटा घर पे कृष्णा है ऐसा लगता है. So that's the positive atmosphere a child brings.
Yeah. The only tough part was initially that she was a person who used to be awake all the whole night. Okay, she sleeps very less as compared to other babies. So puri raat I used to be awake, and next day I used to go to the hospital, and pura din I used to work, and then again I couldn't sleep at night properly. Like every 1.5 hour, 2 hours, you have to. I've forgotten what it's like to sleep for 6 hours. I don't remember how it is. Ki at a stretch 6 घंटे कैसे सोता है? I don't remember that. So every 1.5 hour, 2 hours, you have to wake up, look at the baby, she's crying, you have to feed her and manage. So and with that, you have to work with the same pace in the next day, and nobody at work is going to understand this thing. There's no excuse कि तुम्हारा बच्चा and you are tired, so you sit. Nobody is going to say you that. You have to work like every other day and every other person over there. So it was a tough part. That part I would say I was sleep deprived, completely sleep. Now she though sleeps a little bit. Now it's fine only, but with the academics it was tough for me.
Okay, so after your exams have been over, it has now become, rather than thinking about like sleep deprived, it's just relax.
I would say 80% of my worries have gone, because the background stress about exam hai, you have to study, this topic is left, oh my god, this paper is left, साथ में there is so many things coming up, and you are constantly worried कि अरे कुछ odd paper आ गया तो winters are famous for having odd papers, so odd paper आ गया तो क्या होगा, all these things. तो अब वो सब नहीं है. So I am just focused on कि हाँ अब आगे क्या करना है. I am giving all my time to her, I am giving time to myself, I am sleeping nicely, all these things are happening.
Right.
That is why I've thought about making a channel. It was since a long time I was thinking, but ये सारे issues के वजह से I couldn't give time to that.
Okay. And now I want to just ask you, like Patho में we have to study a lot. I don't know how many viewers are watching this from 2020. I was a second year student, and I was very famous for reading Robbins. For no reason, okay. The whole internet knew me like the person who is reading Robbins. People used to just comment. एक तो मुझे अभी भी comment याद है. There was a non-medico person who was watching my video, and they commented कि Anuj, I watched so much of your videos that I went to see my brother who is a medico and he was studying pathology. I asked him कि why are you not studying from Robbins? So that was the impact I think my videos had in 2020 with respect to this subject. So I think that book is beautiful, but that is only like a small part of the entire pathology. So if you are imagining Robbins to be like this book, you have to imagine 3 or 4 books along with it to complete the entire 4 papers that you have to give. So how did you study in the last 3 months?
Okay, so last 3 months was like I was in 5th year, ठीक है, for studying. जितना तुम पूरे 3 साल में नहीं पढ़ते वो लास्ट के 3 महीने में तुमको पढ़ना होता है. एंड आई थिंक वो अपने आप पेस आ जाता है बिकॉज यू हैव एग्जाम्स ऑन योर हेड एंड यू देयर इज जस्ट नो एक्सक्यूज फॉर इट. तो आई थिंक माई स्केड्यूल वॉज कि बिकॉज ऑफ द बेबी थोड़ा मेरा डिस्टर्प्टेड होता था कि इंटरमिटेंटली आई यूज टू गो इन द लाइब्रेरी जब मेरी घर पे पढ़ाई नहीं हो रही है, और एल्स इफ एवरीथिंग इज फाइन एट होम आई यूज टू स्टडी एट होम ऑल्सो. मॉर्निंग इटसेल्फ यू हैव टू स्टार्ट, एंड आई थिंक एवरी डे मिनिमम ऑफ 8 hours. And during exams I would say it went to like 15 to 18 hours. Exam वाले दिन में तो minimum मतलब अगर if you are thinking कि 5 hours का rest छोड़ करके
पूरा
18 to
सब
19 आवर्स तो तुमको कंपलसरी पढ़ना है. आई थिंक लास्ट 1 week ऑफ एग्जाम एंड उसके पहले तक के इट वाज 8 to 10 hours एवरी डे, मिनिमम ऑफ 8 to 10 hours एवरी डे फॉर 3 months.
Okay. I think almost equivalent to what a person studying for NEET PG prepares.
It is equivalent, yes.
Equivalent, right?
Just difference कि वो NEET PG वाले 1 साल ये करते हैं, हम लास्ट के 3 महीने करते हैं.
नहीं रे, NEET PG वाले भी लास्ट 3 महीने ही करते हैं. तो okay, and just tell us the names of few books that you read.
Okay, so Patho, जब भी whenever you say Patho, what comes in mind is Robbins. Have you heard of Ackerman?
Yeah.
Yeah.
I have talked with you for last 2 years. I know every book.
Yeah, so it's a surgical path book, surgical pathology, which is actually
Sternberg.
pathology. Sternberg, Ackerman, these both are same. Yeah.
So question for the viewers again watching this. Read Sternberg cell lacunar varieties seen in which type of Hodgkin's lymphoma? Okay.
Okay. So Sternberg and Ackerman, and for hematology, of course, I read Kawthalkar sir का. Winthrop भी बहुत अच्छी book है, but it was a reference book. We used to read it कि particular hemat में कोई seminar होगा, so we used to prefer that. And clinical pathology also of Kawthalkar sir only. I think a very beautiful book it is. And there's so much from internet that you can study in Patho. You know, there are so many topics. We have a paper called Paper 4, which is Recent Advance. Uska na, there's no syllabus, there's no book. Literally, can you imagine you're giving a paper without a syllabus? They can ask you anything. They can ask you anything from paper 1 to 3, as well as they can ask you anything of any recent advance. So for that, you have to be constantly upgraded. You have to read the recent articles. I had read so many recent articles at that time. क्योंकि कुछ ऐसे questions होते हैं which is not given anywhere in any book. You have to open the internet for it and go through the recent articles. So apart from books, these are the other sources of studies. There are websites of specially patho जो तुमको देखना पड़ता है. आजकल तो there are things called as digital pathology slide box.
So somebody else's slide you can view on your.
Yeah, you have to subscribe that and like there are 1000 slides का digital slide एक मिलेगा तुमको subscription for 1 year. You can see that slide.
Okay.
Yeah, what I was talking about that digital pathology. No, it's like that.
Okay. So lot of studies and everything. I think that we have talked on almost every topic that you could have asked us to speak about. And yeah, I think this is a good time to say that thank you so much for taking out time to make this video.
And if if still anything is left, you can definitely ask me in comments. I'll reply.
Yeah, or she can make a video on her channel.
Yeah, of course. Please suggest me some of the topics which you would like to see.
Yeah, great. So yes, I think that's it, guys. Thank you so much. I know I haven't been posting very consistently over here, but because पढ़ाई कर रहा हूँ, है ना, 3 महीने बाद नीट पीजी होने के बाद हर हफ्ते will post again. But yes, thank you so much for watching. And thank you so much, Didi, for being here. And yes, I'll see you in the next one. Bye.